Good evening and welcome, everyone. Thank you for joining our live, interactive telephone town hall. My name is Dirk, and I'll be moderating this call. In a moment, we will hear from Mayor Tom McGee, Lynn Public Health Director Michele Desmarais, and 4 local medical experts from Lynn Community Health Center, North Shore Medical Center, and North Shore Physicians Group. They will share information about testing, personal hygiene, vaccines, social distancing, large group gatherings, and compliance with the state guidelines. Now, as mentioned, this is an interactive forum, and we would love to hear from you. We'll be taking as many questions from participants as we possibly can on this event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. Now, we will hand the call over to Mayor Tom McGee for his opening remarks and to introduce the other panelists on the call.
Buenas tardes a todos y bienvenidos. Gracias por acompañarnos esta tarde en este foro abierto interactivo. Soy Dirk y estaré encargado de moderar esta llamada. En un momento escucharemos al alcalde Tom McGee, a la directora de Salud Pública de Lynn, Michele Desmarais, y 4 médicos expertos del Centro Comunitario de Salud de Lynn, North Shore Medical Center y North Shore Physicians Group, quienes compartirán con nosotros información acerca de las pruebas, higiene personal, vacunas y distanciamiento social, reunión de grupos grandes y cumplimiento con los lineamientos estatales. Como mencioné, este es un foro interactivo y nos complacería conocer su opinión. Estaremos tomando las preguntas posibles en vivo de los participantes. Si tienen una pregunta, presione *3 en su teclado y le pondré en espera para hablar con una de nuestras operadoras. Ahora voy a pasar el micrófono al alcalde Tom McGee para que nos dé sus comentarios y para que presente a los panelistas de esta llamada.
Hello and good evening, everyone. This is Mayor Tom McGee, and I want to thank you for joining us for the city's first Tele Town Hall as we discuss important issues regarding COVID-19 in our community. The goal of this event is to provide you with helpful information and to answer your questions pertaining to this topic that has touched each and every one of us over the past 7 months. COVID-19 has truly changed the way that we live and work and has changed our lives in so many different ways. It's incredibly important that we continue to take this seriously for the health and well-being of ourselves and our community. I'd now like to ask each member of the panel to take a moment to introduce and say a few words about themselves, starting with our Public Health Director, Michele Desmarais.
Thank you, Mayor McGee. Good evening, everyone.
Buenas tardes.
I'm Michele Desmarais, Public Health Director.
Hola y buenas tardes a todos. Soy el alcalde Tom McGee. Gracias por estar con nosotros en este primer foro abierto de la ciudad para hablar acerca de los problemas relacionados con COVID-19 en nuestra comunidad. La meta en este evento es proporcionarle información útil y para responder a sus preguntas con respecto al tema que nos ha afectado a cada uno de nosotros durante los últimos 7 meses. COVID-19 verdaderamente ha cambiado nuestra forma de vivir, de trabajar, la forma de vivir en general. Es sumamente importante que tomemos esto en serio para la salud y bienestar de todos nosotros y de nuestra comunidad. Quiero pedirle a cada uno de los miembros del panel que se tomen un momento para presentarse y que den unas palabras, iniciando con la directora de salud, Michele Desmarais.
Thank you very much, Mayor McGee. Thank you. It's my pleasure to be on this call today to speak with all of you and to hope that you will call in with questions, *3, so that we can talk about COVID-19 in our community. I have been a resident of Lynn for almost X amount of years. I won't say the real number. And I am very happy to be your public health director, and I have been public health director for the past 3 years. COVID-19 has been difficult for all of us, very challenging, but I do hope that I can answer your questions tonight and try my best. Thank you.
Hi, this is Dr. Clark Den Berghe. I work at Lynn Community Health Center. I'm a family doctor at that's been there for 3 years now. I do cradle to grave care, so I see babies and see all the way up to adults. and also do deliveries at North Shore Medical Center and Salem Hospital. And I moved here to Lynn 3 years ago, and I'm now a proud resident of Lynn, and happy to be here to serve our diverse population that we see at the health center.
Hi, everybody. My name is Dr. Mitch Rein, and I'm the Chief Medical Officer of North Shore Medical Center. I've lived up on the North Shore for about 25 years, and I've been in my current role for greater than 15 years. It's great to be part of this panel tonight because we're all in this together, and I look forward to providing some education to the community at large.
Good evening, everyone. This is Dr. Barbara Lambl. Thank you, Mayor McGee, and hello to all the good citizens of Lynn. It's an honor to be with you tonight to answer your questions and deal with some of these troubling issues and how they affect us all personally. I am an infectious disease specialist at the North Shore Medical Center. I've also been serving as the hospital epidemiologist for the last 9.5 years and have worked at the Lynn Union Hospital. I have lived on the North Shore for about 20 years now, and it has been a pleasure to care for everybody on the North Shore, and especially to have the opportunity to care for the citizens of Lynn.
Thank you, doctors and Public Health Director Desmarais, for your introductions. So everyone, at this point, we would like to hear from you. We're going to ask a quick poll question. If you are on the phone, you can vote by pressing the corresponding number on your keypad. If you are online, you can vote by selecting your response below the streaming player. I will pause now for translation. I'm wondering if the translator's phone is muted. We'll give a moment.
Bueno, quiero escuchar su opinión. Haremos una pregunta sin encuesta. Si está de teléfono, usted puede votar presionando el número correspondiente en el teclado. Si está en línea, usted puede seleccionar la respuesta en la página.
So here is our first poll question. What could assist with improving COVID safety in Lynn? Press 1 for PPE distribution and awareness events. Press 2 for stronger enforcement of non-compliance. Press 3 for returning to a more restrictive phase. Press 4 for improved public messaging. Press 5 for continuing with status quo. So again, our first poll question: what could assist with improving COVID safety in Lynn? Press 1 for PPE distribution and awareness events. Press 2 for stronger enforcement of non-compliance. Press 3 for returning to a more restrictive phase. Press 4 for improved public messaging. Press 5 for continuing with status quo.
Buena pregunta número 1. ¿Qué ayudaría para mejorar la seguridad de COVID en Lynn? Presione 1 para evento de distribución de equipo de protección personal y concientización. Presione 2 para fortalecer el cumplimiento. Presione 3 para regresar a una fase con más restricciones. Presione 4 para mejorar los mensajes públicos. Presione 5 para continuar con el status quo. Nuevamente, ¿qué ayudaría para mejorar la seguridad de COVID en Lynn? Presione 1 para eventos de distribución de equipo de protección personal y concientización. Presione 2 para fortalecer el cumplimiento. Presione 3 para regresar a una fase con más restricciones. Presione 4 para mejorar los mensajes públicos. Presione 5 para continuar con el status quo.
So while we are tabulating the responses to that poll question, I remind you to press *3 on your telephone keypad if you have a question you would like to ask. and then we will hand it back to the mayor now for additional information.
Mientras que esperamos los resultados de esta encuesta, yo les recomiendo y les recuerdo que por favor presione estrella 3 si tiene alguna pregunta. Y ahora el alcalde con ustedes. Presione estrella 3 si tiene alguna pregunta. Estamos en espera de los resultados.
So, Mr. Mayor, perhaps your phone is muted, sir. While we work to get the mayor's phone connected to this call again, I apologize for the inconvenience, but I will report the results of our first poll question.
Mientras que esperamos que se vuelva a conectar el alcalde, voy a dar los resultados de la encuesta.
So with 42% of the vote, stronger enforcement of non-compliance ranks highest.
El más alto es 42%, es para fortalecer el cumplimiento.
With 20% of the vote, PPE distribution and awareness events comes in second.
En segundo lugar, tenemos para eventos de distribución de equipo de protección personal con el 20%.
With 19% of the vote, returning to a more restrictive phase.
Con 19% es con el lugar número 3 para regresar a una fase con más restricciones, 19%.
With 10% of the vote, continuing with the status quo.
10% de los votos para continuar con el status quo.
And coming in with 9% of the vote, improved public messaging.
Con 9% de los votos tenemos para mejorar los mensajes públicos.
So thank you for participating
Gracias
in
por
our
participar.
first poll. We will have another poll in just a moment. And now let's see if the mayor has been reconnected. Mayor, are you with us again, sir?
I am. I don't know what happened. I was disconnected, so I called back in. So I apologize for the confusion, but I'm back online. I just want to quickly, before we go into some of the questions, because I know some questions are coming in, but I just want to thank the members that are on this call, both from the North Shore Medical Center as well as the Lynn Community Health Center, who have worked really closely with us over the last 6 or 7 months as we really take on this challenge that we face together in the city of Lynn.
Soy el alcalde, disculpa por esta interrupción, hubo me quedé desconectado, solo quiero agradecer, antes de continuar con las preguntas, quiero agradecer al Centro Comunitario de Salud de Lynn y al North Shore Medical Center. Estamos con ustedes.
And I think with that, Dirk, I see that there are a number of questions. I think it'd be great to start to go to some of the questions, and we'll definitely get some of our panel to help us answer some of those questions.
Dirk, yo creo que vamos ahora con las preguntas, el panel, para que nos hagan favor de responderlas.
Our first question comes from Roy, who wonders, I am 70 and want to know if I don't have symptoms, should I get tested every now and then?
Mi nombre es, esta es una de las preguntas, mi nombre es Lynn, tengo 70 años y no tengo síntomas. ¿Ustedes consideran que me debería de estar haciendo pruebas de vez en cuando?
Go ahead. I would ask one of the panelists to jump in and answer that question. I think it's a great question.
Thank you. It's Michele, Desmarais, Public Health Director. And if Dr. Rein or Dr. Lambl, if you will correct me if I'm wrong, but I strongly suggest that everyone should at least have a test just as a balance. I think it's important for everybody to know where they stand. And I think it's better to be safe than sorry, especially now during flu season. That I think, with the flu season coming up, that I would highly encourage everyone to please get a flu shot, and I do suggest getting the test also.
Soy la doctora Michele Desmarais. Sí, yo les recomendaría que sí, que es muy importante hacerse la prueba, especialmente con la época de gripa que ahorita es cuando más necesitamos. Yo recomiendo que todo el mundo se vacune. Es un tiempo muy importante para vacunarse y recomiendo que se hagan la prueba.
This is Dr. Lambl. I do agree with Dr. Desmarais. Right now, what we've seen on the North Shore in our communities, not only in Lynn, but also in Lynnfield, Winthrop, East Boston, Revere, is that cases have gone up in the last 2 months since August. They're still down from the main surge in the spring. We've gone from 90 to 100 cases in Lynn per week down to 7. So it is an improvement, but as a result of this little blip, the Massachusetts Department of Health has started a Stop the Spread program, which includes free testing. So I do agree that
sí, estoy de acuerdo esto ha aumentado mucho los casos últimamente. Se ha ido de 90 casos a 100. 7 realmente es muy poco. He estado trabajando con el Departamento de Salud y creo que es muy importante. Hemos estado viendo casos en North Shore, en Lynn, en varios lugares donde ha habido un aumento significativo.
I would also simply add that routine testing, baseline testing is a good idea, and you can get the test for free until October 31st. You can contact the town hall or go on the website to see where the test is being offered in Lynn. But it's not really recommended to get tested regularly at this time. Certainly is recommended if you have been exposed to somebody who is known to have COVID-19 or have symptoms, have flu-like symptoms, then absolutely you should be tested.
Yo sí recomiendo que se hagan la prueba. La prueba es gratuita en octubre 31. Simplemente pueden ir en línea y pueden hablar para confirmar dónde pueden ir a hacerse esa prueba. Yo solo recomiendo que se hagan la prueba si han estado expuestos con alguien que tiene el contagio. De lo contrario, es nada más hacérsela una vez y estar viendo los síntomas.
And it might be helpful to, at this point, identify there is a number of testing sites in Lynn. There's 3 locations right now that are available. You can get that on the website, but I think it's important to identify that 7 days a week there is testing available in certain locations in the community.
Es importante identificar dónde se están dando estas pruebas, dónde se están ofreciendo las pruebas en Lynn. Hay actualmente 3 sitios, 3 ubicaciones donde se pueden hacer las pruebas. Yo les recomiendo que visiten el sitio web para que vean dónde pueden hacerse la prueba.
And there's 3 locations that are happening right now. Is at the Lynn Community Health Center, the parking lot at Lynn English High School, and the parking lot across from the Market Basket on Federal Street. And again, those times are available on the website for people to identify where they can go and when they can get tested.
Sí, son 3 lugares. Uno es en Lynn Community Center y otro es en el estacionamiento de la preparatoria y otro es en el Market. Pueden, por favor, visitar el sitio web para que puedan ver dónde se pueden ir a obtener una prueba.
So this is Dr. Rein. Can I just offer a response to Roy as well? I just want to be reassuring. The fact that you're not having any symptoms is obviously good, and I agree with the other panelists that getting a baseline test is never a bad idea. But perhaps as if not more important than the testing is practicing some of the other things that we know will prevent this condition. You are in a high-risk group because of your age, but things like frequent hand hygiene, practicing the social distancing, masking when you're around other individuals, trying to avoid large gatherings, I think that's as and maybe even more important than your question about testing.
Sí, es muy importante estar pendiente de sus síntomas, creo que es muy bueno y es importante también que se haga la prueba, pero creo que también lo más importante que debemos de tomar en cuenta, porque usted es una persona que está en alto riesgo, es que sigan los lineamientos que hay que seguir, como lavarse las manos, el distanciamiento social, el uso del cubrebocas y evitar las reuniones con grupos grandes.
And this is Dr. Clark. I would also just add that an important piece of this is that many people who have the infection can have no symptoms. So that's why a baseline test can be helpful. But I also hear a lot of my patients that say, I don't have any symptoms, so I don't need to be tested. I think if you have any symptoms whatsoever, please come and get tested. You can do walk-ins without any appointments. And so we don't want to discourage you from coming in to get tested. And also the other piece, I would also echo the other safety measures are probably even more important because your test only tells you where you are at this point in time. But if people are exposed to the virus and they can be contagious 2 days before they even have symptoms. And so just because you have a test doesn't mean that you can relax the other measures.
Doctor Cork, mucha gente que está infectada no está o que tiene ya el contagio no tiene ningún síntoma. Entonces eso es muy importante que estemos muy pendientes de nuestros síntomas. Usted puede venir sin una cita, puede venir para que se le haga una prueba. Es muy importante, realmente no queremos desalentarlo. Y también es muy importante las medidas de seguridad porque eso es lo más significativo. Es muy importante también que si se ha estado expuesto, muchas veces está expuesto y tiene aproximadamente, no tiene ningún síntoma y los síntomas solo aparecen 2 días antes de que usted haya sido contagiado.
I think that's answered that question. Dirk, I might be able to head on to another question.
Our next question comes from Mo online, who says, early on, a lot of the testing showed false negatives. Has that improved?
Una de las preguntas es de que muchas de las pruebas en ocasiones se presentaron como negativos. ¿Esta situación ya mejoró?
So, Barbara, I'll start, and then you may have a little more specificity. But, Mo, I think, the bottom line is the testing does continue to improve, and that's what we call the sensitivity of the test as well as the specificity of the test. All of the different tests do still have some risk of false negatives. And you may be familiar with the rapid test where you get a result immediately, as well as tests that take perhaps anywhere from a day to 3 days to return. The rapid test, I believe, does have the higher rate of false negatives, but it's also got the advantage of immediate results. And Barbara, I'll let you clarify whatever I got wrong and or some more detail.
No, you're absolutely right, Mitch. I'll let the translator translate.
La prueba está mejorando, es muy importante, tiene que ver mucho con la sensibilidad, pero que aún sigue habiendo cierto riesgo. Claro, hay riesgo de que tengamos un reporte falso de negatividad, pero la prueba tiene como que regresa en 1 o 2 días, esa tiene más certeza. En cambio, la prueba rápida, esa tiene más riesgo de aparecer con un negativo falso.
Yes. So the tests right now, the most accurate test is the nasal swab, and it's called a PCR test. That is the most accurate test. It's much more accurate than the rapid nasal swab or the saliva test.
Muy bien,
So if you can,
la prueba más precisa es la de que se hace con el hisopo en la nariz. Se le llama la PCR. Y también tenemos otra.
the rapid test is also done as a nasal swab or as a saliva test, but there are false negatives. That is the problem, that the test can come back as falsely reassuring that you do not have coronavirus when in fact you do. So that is the limitation of the rapid test and the saliva test at this point.
La limitación que hay con el examen rápido y con el examen de saliva, que también se hace con un hisopo, es de que sí puede regresar con un negativo falso. Regresa como que usted no está padeciendo del coronavirus. Esa es la limitación que continuamos hasta ahorita.
And in fact, we saw that happen at the White House this past week. They ran rapid tests which were falsely negative and reassured people, unfortunately.
Eso lo vimos también en la Casa Blanca, eso que llevaron a cabo ese tipo de exámenes rápidos y desgraciadamente le informaron a la gente, o sea, con los resultados que no eran precisos.
And this is Dr. Clark again, and you can correct me if I'm wrong, but the tests that we are doing at the testing sites in Lynn, those are nasal swabs that are not the rapid test, and they result anywhere from 2 to 7 days, but they're right now, at least at the health center, are coming back in 2 days, and the rapid swabs are only available in the hospital.
Muy bien, nosotros ahorita estamos llevando solo lo del hisopo nasal. Ese tipo de examen que estamos llevando a cabo tarda de 2 a 7 días. Por lo regular son 2 días. Y el examen rápido, la prueba rápida, se está llevando solamente en el hospital.
This is Michele. I would like to just also tell people that the test has improved immensely since the beginning. It's not as everybody thinks that the swab touches your brain. It's not as intrusive. So I would encourage everybody to try to go have a test.
Solo lo único que quiero agregar es que sí, la prueba ha mejorado muchísimo. Muchas veces mucha gente piensa que el hisopo, que es el hisopo nasal, piensan que va a llegar y le va a tocar hasta el cerebro, pero pues realmente no es así. Estos exámenes que estamos llevando a cabo son mucho más seguros y mucho más confiables.
I think we've covered that question, unless anyone else has a point to make, and I think we may be ready for another question, Dirk.
Yes, sir. Quickly, just a reminder, if you would like to get in the queue to ask a question, you can press *3 on your keypad if you are on the phone. If you are streaming online, you can submit your questions below the streaming player. We will try to get to as many questions as possible tonight.
Muy bien, solo queremos recordarles que si tiene alguna pregunta, por favor, presione *3 y una de nuestras operadoras tomará su pregunta. O si está en línea, puede ir al sitio web y puede ahí escribir la pregunta.
Our next question comes from Joseph, who asks, are you having Halloween this year? Is there a particular area in Lynn that has a cluster? Because I keep seeing that the city is in red.
Solo una pregunta. Quiero saber si se va a llevar a cabo los festejos de Halloween. Sé que estamos en una situación diferente en Lynn y por eso quiero saber que estamos en una situación altamente de riesgo.
I can speak at least initially to the Halloween question. We have put together both a flyer, and we'll be posting it on our website in terms of the risks, the Halloween risks. We're strongly recommending that people don't partake in high-risk Halloween activities. That would include traditional door-to-door trick-or-treating or handing treats to children individually.
Les voy a hablar un poquito, voy a responder acerca de la pregunta de Halloween. Va a haber un volante y vamos a hacer publicidad para que la gente no salga a pedir dulces y que también no se reúna, que no se recomienda que también la gente le dé dulce a los niños en estos momentos.
And just I would ask people to check out the website. Like I said, we will be having flyers that are out around the community, and it identifies low risk activities, moderate risk activities, as well as high risk activities. And again, would ask that you those guidelines are coming both from the CDC as well as the state DPH.
Ahora yo les voy a recomendar que revisen la página web, es muy importante y puede ver las actividades que son de más alto riesgo, de riesgo moderado o de riesgo bajo. Estas son las recomendaciones que está dando el Centro de Enfermedades Infecciosas. Si por favor quieren revisar la página web.
And we'll continue to disseminate that information through numerous venues or opportunities to get that information out to all members of the community over the next several weeks.
Seguiremos publicando, durante las siguientes semanas seguiremos publicando ese tipo de información y dando más información para que, por favor, respeten esos lineamientos.
Any other thoughts from any of the panelists related to that question?
Hi, it's Michele. I would try to discourage anyone from trick-or-treating.
Recomiendo que la gente no salga a pedir dulces.
I think that it's important to understand that there would be a lot of people touching the candy, of putting their hands in the bowl. I think at this time it is a little bit more risky, and I would discourage trick-or-treating at this time.
Yo recomiendo que no se haga en este momento porque la gente se reúne, tiene más riesgo, la gente mete la mano en el plato donde están los dulces, es un riesgo muy alto. Así que yo recomiendo que no se lleve a cabo.
And just to follow up on that and to reiterate, we strongly recommend that people do not participate in the high-risk lists of Halloween activities. And again, that list and other options will be on the website.
Les reitero, recomendamos que no participen especialmente en ese tipo de actividades que son de alto riesgo y también les recomiendo que visiten la página web donde pueden obtener mayor información.
Yeah, this is Barb Lambl. I would reiterate those cautions. The high-risk activities that the mayor is referring to are the big gatherings, the parades in that the North Shore is famous for, and also the going house to house trick-or-treating. We know that the infection is spread through the hands, and the hands will contaminate the candy even if they're in wrappers. So the CDC.gov website has good information for families, and they make suggestions about alternate activities, including organizing scavenger hunts for your family in your own yard, and trick-or-treat rewards for the scavenger hunts, and movie night with scary movies for the family are better options, are low-risk options for celebrating Halloween.
Voy a recomendar, voy a reiterar lo que dijo el alcalde y también lo que es más importante, que se recomienda que no vayan a reuniones para este festejo, que no asistan a desfiles, algo que es muy común aquí en North Shore. Yo les recomiendo que mejor estén en casa. Una de las formas de contagio son las manos y pues muchas veces, aunque los dulces estén envueltos, de todos modos se puede pasar ese contagio. El CDC tiene una lista donde de información acerca de lo que se debe hacer para evitar cualquier contagio. Lo que yo les recomiendo es que organicen cierto tipo de actividades alternativas, como por ejemplo tener una búsqueda de dulces en el patio o otro tipo de eventos como el cine en el patio, actividades que puedan hacer en su casa.
I would also add that the CDC website for our Hispanic and Latino residents has a very nice page also about the Dios de los Muertos celebrations, alternatives for safe celebration of Dios de los Muertos.
También el Centro de Enfermedades Infecciosas tiene una página web muy interesante, muy importante para los hispanos y latinos. Tiene una información acerca del festejo del Día de los Muertos, acerca de actividades que puedan llevar a cabo alternativas a las que se llevan regularmente.
Well, thank you for that. If we could go into another question, Dirk, I don't know if you wanted to go to the second poll question.
Yes, Mayor, let's do the poll question. So if you are on the phone, you can vote by pressing the corresponding number on your keypad. If you are online, you can vote by selecting your response below the streaming player.
Vamos a la segunda pregunta de la encuesta. Si está en el teléfono, puede presionar uno de los números que le mencionamos en su teclado, o si está en línea, puede ver la página y ahí dar su respuesta.
How has COVID-19 affected you the most? Press 1 for food security. Press 2 for loss of job or income. Press 3 for tested positive or lost someone to COVID-19. Press 4 for housing insecurity. So that question again, how has COVID-19 affected you the most? Press 1 for food security. Press 2 for loss of job or income. Press 3 for tested positive or lost someone to COVID-19. Press 4 for housing insecurity.
La pregunta de la encuesta es, ¿cómo le ha afectado más COVID-19? Presione 1 para seguridad alimentaria. Presione 2 para pérdida de trabajo o ingresos. Presione 3 para resultados positivos o haber perdido a un ser querido por COVID-19. Presione 4 para inseguridad de vivienda. Nuevamente, ¿cómo le ha afectado más COVID-19? Presione 1 para seguridad alimentaria. Presione 2 para pérdida de trabajo o ingresos. Presione 3 para resultado positivo o haber perdido a un ser querido por COVID-19. Presione 4 para inseguridad de vivienda.
While we calculate the answers, here is another online question. Miguel asks, are flu shots free?
Mientras que calculamos las respuestas, tenemos otra pregunta. ¿La vacuna es gratuita?
This is Michele. The City of Lynn Health Division is having 2 flu clinics open to the public. And yes, there are free shots. October 15th at Marshall Middle School, 3 p.m. to 7 p.m.
Ahora tenemos 2 clínicas para vacunas contra la gripe. Es una octubre 15 en la escuela Marshall de 3 de la tarde a 7 de la noche.
And also October 24th at Breed Middle School from 10 a.m. to 2 p.m.
También el 24 de octubre tenemos en Tree Middle School de 2 de la tarde a 7 de la tarde.
And I'll just make a point to that. All Lynn residents over the age of 6 months old are welcome and encouraged to come, regardless of insurance or immigration status.
Y se recomienda a todos los residentes de Lynn que tengan de 6 meses o más que vengan a vacunarse. Esto es gratuita, sin importar su estado migratorio, no importa cómo sea, la vacuna es gratuita.
And on October 24th, as part of the free flu clinic at Breed Middle School, there will also be a care kit distribution at Lynn Classical High School on the same day during that period of time. So the flu clinic will be happening at Breed Middle School, and the care kits will be available at Classical High School.
Michele, this is Dr. Rein. I just want to also reassure you, besides being able to get the flu shot free, as you were just informed, the flu vaccine is extremely safe. And so I know that some individuals are concerned about vaccinations in general, but these flu vaccines have been around for a long time. It's really the best way to prevent the flu. And this is a year where it is just exceptionally important that we do everything that we can to keep the flu season at a minimum because of the risk of flu and COVID at the same time could really be devastating to people that got both illnesses. So everybody, in my opinion, this year should get a flu shot. There are very, very rare medical reasons why you should not, but I just wanted to emphasize that.
Quiero enfatizar que también el 24 de octubre tenemos en la clínica de vacunas contra la gripe, se va a estar dando la vacuna y aparte se va a estar dando unos kits gratis. También el doctor quiere confirmar y asegurarles que es muy importante que se vacunen contra la gripe. ¿Por qué? Porque ahorita es un momento muy, muy difícil. Es una situación donde estamos viviendo dos enfermedades, hay síntomas muy parecidos y es sumamente importante que ayudemos a combatir esta enfermedad y si todos nos vacunamos.
This is Dr. Clark
Please go ahead.
At Lynn Community Health Center, we are also offering flu vaccinations for all of our patients. They're available now, and they're covered by insurance. And we also have a walk-in flu clinic every Saturday from 9 to 12 that anybody can come to.
También usted, doctor, en nuestro centro de salud, ahí va, como tenemos las vacunas contra la gripa, cubren los seguros. Es muy importante que ustedes, si quieren venir, no necesitan hacer cita. Estamos de 9 a 11.
And this is Barb. I would just add to what Mitch and Clark said that the vaccine is extremely safe. And this year, above all, you want to protect yourself from the flu. The vaccine is very, very effective, over 60% effective in young people, middle-aged people, a little bit less effective in the elderly, but still we have a stronger vaccine for the elderly and it's quite safe. You do not want to take a chance with getting a double viral infection this season because they are both deadly, and we know that the coronavirus is more deadly than the flu.
Es muy importante que también les quiero recordar que esta vacuna es muy segura y es muy eficaz en 60% de los casos, especialmente para jóvenes y adultos. Para las personas mayores tenemos una vacuna más fuerte que ayudará y les recuerdo que es necesario que se vacunen porque la enfermedad del coronavirus es mortal y si padecemos estas enfermedades pues tenemos problemas muy graves para poder resolverlos.
Great. I appreciate the answers to that question. It is very important, and I'll just emphasize for people in the community to get the flu shot this season in particular.
Les quiero enfatizar nuevamente que es muy importante que ustedes se vacunen contra la gripe. Es muy, muy importante, especialmente en esta temporada.
I don't know if there's another question we have, Dirk, at this point.
Yes, Mayor, there is. And a number of questions, including one about antibodies. But first, I would like to give the poll results.
Les voy a decir, si tenemos es una pregunta acerca de anticuerpos, pero primero que nada voy a dar la respuesta a la encuesta.
The response to the question, how has COVID-19 affected you the most? With 39% of the vote, loss of job/income.
A 39% es para la pérdida de trabajo o ingresos.
Coming in second with 30% of the vote, food security.
En segundo lugar, con 30% tenemos seguridad alimentaria.
Next, with 20% of the vote, tested positive or lost someone to COVID-19.
Con 20% tenemos el resultado positivo o haber perdido a un ser querido por COVID-19.
And with 11% of the vote, housing insecurity.
Y con 11% de los votos para inseguridad de vivienda.
Now, back to the phone with a question from Susie. Where can I go to get the antibody test to find out if I had COVID?
La pregunta es de Susie. Quiero saber a dónde puedo ir para recibir la prueba de anticuerpos y saber si ya tuve COVID.
Oh, sure. I will just say this and then turn it over to Clark, that the antibody test can be done if you have had symptoms and you had a negative nasal swab. All you need to do is contact your primary care physician and they can order the test for you.
Para la prueba de anticuerpos se puede hacer si ha tenido síntomas y ha tenido resultados negativos y se puede hacer con la prueba nasal de hisopo. Usted puede hacer una cita con su médico general y ellos ordenarán este tipo de prueba.
I'll just echo that any doctor can order that, but even if it comes back positive, we still don't know the long-term consequences of that and that if you're immune because of it. And so it does not excuse you from continuing to do measures such as social distancing and wearing a mask.
Sí, solo quiero reiterar lo que dijo la doctora. Si regresa positivo, también no quiere decir que usted sea inmune. Usted lo importante es que practique el distanciamiento social y que use cubrebocas.
This is Dr. Rein. I would just add to Susie's question that the antibody test is one, I'd say in particular, that we're still learning a lot about as we're continuing to learn about the virus. And so I suspect over time that this test will also improve and the indications for getting the test will become a little bit clearer. I think the other physicians answered the current indications, but it's not as widely available, and so you might be a little bit frustrated if you're trying to get the antibody test. Your provider tells you that it's not necessary. I would agree with the other comments about all the other precautions around masking and hygiene, hand hygiene, and social distancing are just so much more important.
Ahora, quiero reiterar sobre la prueba de anticuerpos. Ahorita todavía estamos conociendo mucho de esta prueba y mejorará con el tiempo. Hay muchas indicaciones de así será. Muchas veces usted se podrá frustrar porque no está disponible y a lo mejor también su proveedor le va a decir que no está disponible, que no es necesario. Pero es importante que se la haga. Lo que les recomiendo, que es muy importante, es que se lave las manos, que practique el distanciamiento social y que use cubreboca.
Thoughts on that? We may have time for another question, Dirk.
Yes, sir. This question comes from Gordon, who asks, is it possible to get the virus again?
Otra pregunta, ¿es posible padecer el virus nuevamente?
I think it's a good question on our panel. Who would like to take a shot at that, answering that question?
I can.
Go ahead, Barb.
Yeah, I'll take the first stab at it, Mitch. Even though we've learned a lot in the last 7 months, there are still some unknowns about this virus. Dr. Den Berghe already mentioned the fact that just because you've had the virus and you have a positive antibody test doesn't mean that you're protected from a second infection. And what we fear is that this virus, the coronavirus, may be like the flu. It can come back on you several times, even though you've had it before, because there are different strains that evolve over time. So we don't know for sure whether you can get the virus. That research is still ongoing. There was one case report from Hong Kong of a young man who did, in fact, have 2 COVID-19 infections, one that he got in Hong Kong and then a second one that he got in France when he was traveling. So I just want to reiterate the importance of the bundle of measures that protective measures that people need to take to guard themselves against respiratory infections.
Hemos aprendido mucho de este virus desde en los últimos 7 meses y como el doctor Den Berghe dijo hace un momento que aunque su prueba de anticuerpos regrese positivo, no quiere decir que usted ya está protegido contra el virus. El temor es de que el virus, o sea, el coronavirus, lo puede usted volver a padecer. Esta enfermedad evoluciona y es posible que se vuelva a padecer. Conocemos de un caso de Hong Kong donde una persona se infectó 2 veces de COVID, una vez que viajó a Francia, una vez en Hong Kong y otra vez que viajó a Francia. Y por eso es que es muy importante y reitero que las medidas de protección son las más importantes para poder combatir la infección.
So I guess I would add that we hope that with antibodies that it will offer some protection. That is what the goal of the vaccine is. But it's so new that we don't know about the risks of reinfection, especially with the risks of mutation of the virus, such as the flu does.
Quiero decirles que, por ejemplo, que lo de anticuerpos es muy importante, que sí se tiene protección, pero el riesgo de reinfección, pues es posible. Hay muchas mutaciones en este tipo de enfermedades y es como habíamos comentado acerca de la gripe, por ejemplo, que también puede ir evolucionando.
I'm sorry, this is Michele. Could I make a clarification, please, on a previous question that was asked?
Quiero aclarar una pregunta que se hizo, una respuesta a una pregunta.
Lynn, the City of Lynn is working with the Massachusetts Department of Public Health in the Stop the Spread, which does provide the city testing. So I know that at this moment, it does say that October 31st, but we always are fortunate where it will be extended. And it is important to note, too, that Lynn Community Health Center also has testing. So testing in Lynn will be available until Lynn gets to a different color, according to the governor's colors that he picked. So there will be testing in Lynn available to everybody, just to make that clear.
Okay, quiero reiterar de que en Lynn tiene un acuerdo con el Centro de Enfermedades que tendrán la vacuna gratuita hasta el 31 de octubre, pero esta fecha se extenderá para la comunidad de Lynn, especialmente hasta que no bajemos a otro color, a otro nivel de riesgo que el gobernador especificó.
So we are coming to the end of our live event this evening. Thank you for taking the time to join us for this important City of Lynn Tele Town Hall on COVID-19. We appreciate the opportunity to speak directly with you and answer your questions. We will host more of these events in the future to keep you informed on what we are working on and other important updates. I will now turn it over to Mayor McGee for his closing remarks.
Estamos a punto de terminar este evento. Gracias por acompañarnos en este tan importante foro abierto de la ciudad de Lynn acerca de COVID-19. Agradecemos la oportunidad de hablar directamente con usted y responder a sus preguntas. Estaremos llevando a cabo más eventos como este en el futuro para mantenerlo informado acerca de lo que estamos haciendo y acerca de otras actualizaciones importantes. Ahora voy a pasar el micrófono al alcalde McGee para que nos comparta unos comentarios finales.
Thank you for joining us this evening, and I want to put thanks to our guest panelists for taking the time to be here with us tonight as well. And I also want to thank Dirk as our moderator and Anna as our translator. They've both been great, so thank you. I hope this was informative, and this will be the first of many for this new way of communicating with all of you. Our actions or lack of responsible action in following the COVID-19 guidelines and personal hygiene practices will determine how we limit the spread in our community and ensure that we keep our community safe. I know this has been a very unique year for all of us, and we have not been able to engage in the same type of activities that we are all accustomed to. However, we as a community need to continue to do everything we can to curb the spread of coronavirus so that we can get on a healthier path and get through this together. There are several ways to stay informed and up to date on COVID-19 information in Lynn. You can follow my Facebook page, Tom McGee, Mayor of Lynn. Visit the City of Lynn's COVID-19 resources page on our website, lynnma.gov/COVID-19/resources, or sign up for our City Smart 911 alert system by going to smart911.com. Again, thank you for taking part in this call, and I hope that you all stay diligent, healthy, and safe.
Gracias por estar con nosotros esta tarde. Le agradezco a todos los panelistas por tomarse el tiempo de estar con nosotros esta tarde. Espero que esta información haya sido útil y será la primera de muchas que estaremos llevando a cabo en el futuro para comunicarnos con usted. Nuestras acciones o falta de acciones responsables para seguir los lineamientos de COVID-19 y prácticas de higiene determinarán cómo limitamos el contagio en nuestra comunidad y asegurarnos de que nuestra comunidad esté segura. Reconozco que ha sido un año muy singular para todos y no hemos podido llevar a cabo el mismo tipo de actividades a las que estamos acostumbrados. Sin embargo, como comunidad debemos de hacer todo lo posible por poner frente al contagio del coronavirus y así poder seguir un camino más saludable y vencer esto juntos. Existen varias formas para mantenerse informado y actualizado acerca de COVID-19 en Lynn. Puede seguir mi página de Facebook, Tom McGee, Mayor of Lynn, visitar la página de recursos de COVID-19 para la ciudad de Lynn en el sitio web lynnma.gov/COVID-19/resources o registrarse en el sistema de alerta Smart 911 de la ciudad visitando smart911.com. Gracias por tomar parte en esta llamada. Manténgase atento, saludable y seguro. Gracias.